2006. I'm sorry. The tumor
September
is malignant.
2007.
You have cancer.
I'm sorry. The tumor is
July
malignant. You have
2014.
cancer.
I'm sorry.
September 2007.
January
I'm sorry.
2010.
The tumor is malignant. You have
July
cancer.
2009.
September
December
2007. I'm sorry.
January
I'm sorry.
2010.
Tumor is malignant. You have cancer. September 2007.
Stop!
I'm sorry, the tumor is malignant. You have cancer. How can 9 simple words cause so many people so much terror, anguish, and pain?
Maybe before we look at that, we need to define what exactly cancer is.
Ooh, pick me. I know the answer. Cancer is the 4th sign of the zodiac that comes between Gemini and Leo and has a crab as its symbol.
Not that cancer, Dinglebutt, the disease!
Oh, the disease. There are more than 120 different types of cancer, which can be defined as a malignant tumor of potentially unlimited growth that expands locally by invasion and systemically by metastasis.
Which means what exactly? Well, something that is malignant is very serious and dangerous and tends to grow and spread in a rapid and uncontrolled way that can cause death.
And if that specific tumor has metastasized, it has spread disease-producing cancer cells from the initial site of disease to another part of the body.
In other words, because someone has melanoma, those cancer cells can move to another part of their body and cause cancer there as well.
So does that mean that the cancer will never leave someone's body once they get it?
No. First of all, there are several stages of cancer that are used in diagnosis and treatment. Explaining them, as well as some common terms, might make the rest of our job easier. First, some general terms. Benign
refers to a tumor that is not cancerous. The tumor does not usually invade nearby tissue or spread to other parts of the body.
Carcinoma, cancer that starts in skin or tissues that line the inside or cover the outside of internal organs. Invasive cancer,
Cancer that is spread outside the layer of tissue in which it started and has the potential to grow into other tissues or parts of the body.
lymph nodes,
Tiny, bean-shaped organs that help fight infection.
malignant, refers to a tumor that is cancerous. It may invade nearby healthy tissue or spread to other parts of the body. Tumor,
A mass formed when normal cells begin to change and grow uncontrollably. A tumor can be benign or malignant.
there are 5 basic stages used to diagnose and treat cancer. Stage 0, or in situ, means that this cancer is in the position where it started. Some cancers may never go beyond this early stage.
Stage 1, localized cancer. At this next stage, the cancer cells gain the ability to invade neighboring tissue.
Stages 2 and 3, regional spread. Once a cancer cell has invaded, a common next step is for one of its daughter cells to invade through a lymph node.
There it might provoke an immune response against it, which can go on to destroy it and cancer cells, which would take care of the problem.
Stage 4, distant spread. The next step can be quite varied. Cells from the lump in the lymph node may spread further to more distant lymph nodes or on into the bloodstream.
Either way, once in the bloodstream, the cancer cells can go just about anywhere in the body, form new colonies, and spread further.
Okay, so now we are totally depressed. Does all this mean that a cancer diagnosis is fatal? Not at all. Millions of people are cancer survivors. However, beating cancer is not like getting over a sprained ankle or chickenpox.
The typical treatments include surgery, radiation, and chemotherapy.
Surgery is the easiest treatment to explain. Simply put, the doctor goes into the affected area of the body and cuts out the tumor. Side effects are minimal and are the same as for any surgical procedure.
Radiation therapy is the use of high-energy X-rays to kill cancer cells and stop them from growing and dividing.
Side effects of radiation differ for each person, may take several weeks to appear and several more weeks to disappear after the treatments are completed. Typical side effects include fatigue, nausea, vomiting, diarrhea, dry mouth, and a loss of appetite or taste for food. Chemotherapy is the treatment most people have heard of. It is usually given in the form of an intravenous injection or drip.
Because it gets into the bloodstream, chemotherapy can treat cancer throughout the body.
In essence, chemotherapy works by putting large amounts of poison into a patient's body. Because this is such a drastic act, the side effects of chemo are numerous and sometimes debilitating. They include
nausea and vomiting,
red, orange-colored urine,
bone pain,
changes in sense of smell and taste,
low red blood cell count,
increased risk of infection,
sore mouth,
constipation,
fatigue.
hair loss.
But how does cancer really affect people? This all sounds very cold and clinical. Then let's look at this from a different point of view, that of those who have been directly affected by cancer.
4 points of view.
4 different lifestyles,
4 different types of cancer, but numerous families affected and reacting in diverse ways.
The Hollowed Gourd by Stephanie Nugent. Like a ripened fruit at fall harvest, I am picked in my prime. The knife cuts deep into flesh. Haphazardly at first, the meat is spooned out and discarded.
June 20th, 2006. My own personal day that will live in infamy. The day I was diagnosed with my own personal version of hell. Ductal carcinoma. Invasive breast cancer, stage 3. Oh my God, I'm going to die. I don't want to leave my little girl. She's only 6 months old.
Okay, Stephanie, get it together. Get it organized. What do I do first? What do I do second? What do I do?
Lots of tears, especially for Mom.
Dad was my comfort, my strength. We will get through this.
How?
My co-workers covering classes, collections, house cleaning.
The shave party where everyone shaved their own heads and held my hands while I shaved mine.
Finding a wig and learning how to take care of it.
Connecting with the cancer community.
The multiple surgeries to cut it out.
The multiple surgeries to reconstruct.
The chemo.
The radiation.
the
drug therapies,
And through it all, the fear.
The chemo brain with 6 months in a fog.
The teeth-grinding anxiety.
The disabling panic attacks.
The runaway emotions. The crying, the looks and the comments from the public. The anger at God. And even though this is something that becomes a part of you always,
Don't let it be your only label.
breast cancer survivor.
Then carefully, it is scraped clean from the inside out. The sculptor stands back to contemplate his next move. A series of decisive cuts are made, chunks are removed and thrown aside.
I miss my sister. She was my best friend, my inspiration. I know she is looking out for me.
Diamond Hawk was an 18-year-old high school graduate when she finally succumbed to PTLD, an aggressive form of cancer that is occasionally found in post-transplant patients.
Diamond had organ transplants in 1999 at the age of 6 for her kidney and liver.
Before as well as after the transplants, she had one passion: dance.
After her transplants, she could not believe how much better she felt and how much energy she had.
But before long, she began to feel that something was wrong again, and in 2007 had her spleen removed.
And all would be fine for 3 years. In January 2011, doctors found out why she was feeling dizzy. She was diagnosed with a brain tumor.
Not again!
Surgery, spinal radiation, chemo. Kids picking on her because they thought she was contagious. Best friends stopped talking to her.
And then 10 months later, abdominal cancer.
What? She has already gone through so much!
Chemo once again, but this time, the chemo stopped her heart. For good.
She taught us to treat people well and to enjoy life because you don't know when it will be gone. Go up to those who are alone and let them know they are not alone. We are all in this fight together.
He stands back again and grimaces. A scarred shell stares back. He moves and places something inside. The light attempts to fill the emptiness. He is satisfied.
A what? I have a what? What the heck is an acidic cell carcinoma?
ACC is a rare salivary gland cancer, which themselves only comprise about 0.5% of all cancers in the U.S. Congratulations, Jane. You have the distinction of contracting one of the more rare, but least invasive forms of cancer.
But still, it is cancer, and it is dangerous if not taken care of right away.
Monday, to the doctor to see what the spot behind my ear is. Tuesday, to Mercy for an ultrasound. Wednesday, back to Mercy for an MRI. Friday, a visit to the surgeon to plan out the surgery date.
Wait. This is all going way too fast.
Home from Alaska on Monday, surgery on Wednesday.
To the doctor on Friday to remove the bandage and drainage port.
Back to the doctor on Wednesday for a checkup. 1 week and still no word. Is it cancer or not? Finally, after almost 2 weeks, the answer is given and off to radiation.
30 days, Monday through Friday, became the routine.
Up by 8, on the road to the cancer clinic by 9, and get shot with radiation. But even radiation has its side effects. Fatigue, usually at the drop of a hat. Loss of taste.
Dry mouth.
Let me sit here. I don't want people to see my incision. And next time, if you feel something weird, don't wait. Go to the doctor.
Placed in a position to be admired, the gourd sits, eventually withering at first frost. How odd to realize I am like a gutted, rotting fruit.
As bad as the cancer diagnosis is for an adult, imagine being 4 years old and learning you might die. How do I tell my daughter, my baby, my Anna, that she has leukemia? I can't do this. She is too young to go through cancer.
Will she even realize what is going on?
The only positives were the assurances we got from the doctors. We caught it early.
We have so many new treatments.
She will be okay. Then it started. Shots in her legs. Her milk medicine to put her to sleep before the spinal chemo. 14 pills daily. Steroids that sent her from 42 to 56 pounds within 1 month. Then her stomach couldn't process nutrients, and she dropped to 36 pounds 1 month later. The endless bouts of steroid-fueled crying.
The terror of losing her hair.
Are you a boy or a girl? The realization that there is no child chemo. It is adult chemotherapy manipulated for children. The chemical smell coming from Anna's body.
Having to use different toilets because her urine was toxic.
Thinking each morning that it was all just a nightmare. Then waking up to reality. Dressing and acting nicer in the hopes that they would give Anna the secret medicine to make her better. Being completely exhausted all the time. The heartache when friends disappeared. The ongoing hope that this insidious disease is finally gone, for good. So what can people do to help prevent cancer? It is well accepted that your chances of developing cancer are affected by the lifestyle choices you make. First, don't use tobacco in any form. Second, eat a healthy diet. Third, maintain a healthy weight and be physically active. Fourth, protect yourself from the sun. Stay in the shade.
Avoid the midday sun.
Cover exposed areas.
Use lots of sunscreen.
And avoid tanning beds. Fifth, get immunized, especially for hepatitis B and HPV. Sixth, avoid risky behaviors by practicing safe sex and by not sharing needles. Finally, regular self-exams and screenings for cancer such as skin, colon, prostate, cervix, and breast can increase your chances of discovering cancer early. Stand up to cancer. You beat cancer by how you live, why you live, and the manner in which you live.
Stand up to cancer.
I'm standing up for Stephanie Nugent.
I'm standing up for Les Chelsvig.
I'm standing up for Diamond Eye.
I'm standing up for Karen Sturts.
I'm standing up for Heather Sorensen.
I'm standing up for Jane Shapiro.
I'm standing up for Blake Woods.
I'm standing up for Landon Fredrickson.
I'm standing up for Grant Schoenhardt.
I'm standing up for Anna Richmond.
Wednesday, April 29th, 2015. I'm sorry, the tumor is malignant. You have cancer.